Hi, I'm Kaylee, social worker, and I've asked you to come and talk to me today just to share a bit about who you are and what you're doing.
So I'm Clare Warriner, and I work with a station that works with couples around domestic violence and parenting, safe parenting, and that's called For Baby's Sake. And that's one of the things I do. And I've worked for the local authority for the past 3.5 years, I think. But the other thing that I'm passionate about and that myself and a colleague have started is a community interest company called Talk Trauma. And that really has been born out of our passion to promote a different way of working, primarily with women who have experienced complex trauma, to look at different ways of approaching that, providing a response, and also for training of frontline workers, just to perhaps give them some different skills and a different perspective on really good ways that work when you are working with adults who've experienced complex trauma. Two things that I'm really passionate about at the moment. A lot of the adults that I've worked with, a lot of the women I've worked with over the years have had really difficult childhoods that have had an involvement with children's social care, a significant one, and many different services. We ask people to tell us their history again and again and again, don't we? And we expect them to give us everything every time, all of it, just that in itself. There is a kind of phrase which is around people being re-traumatized. And I just think it's also exhausting. I think there's an element of that that's exhausting, and I can understand why people get angry or defensive or just don't want to engage with you, just don't want to tell you again,
Yeah, and I think that in adult social care, there's something called making safeguarding personal. And what they found from that was sometimes people's lives were made worse because they felt like they were going through a process they weren't really involved in, and the outcomes actually didn't help them. So I think thinking about that was probably what drew me to what you were saying initially about some of the positive stories that you were sharing with us. Maybe you could share them at the moment now. Would that be possible? How your support has benefited people so far?
I think, the last few years, I've worked with women predominantly and in lots of different settings, from prisons to community, women in their own homes, and then in group settings. And I think that one of the key elements around engaging in any kind of trauma work is that you create an environment of safety, because by its very nature, if you're experiencing trauma, you don't feel safe in your body, and I think somebody has got to be able to feel safe, to be able to start talking, and that can be quite a slow process, really. And I think a lot of the women that I've worked with, have a perception of themselves which is largely informed by other people's views of them, things they've read, things that people have said to them. It's quite incredible that women can remember, some kind of almost like a throwaway comment that women can remember from years ago that's stuck and become a part of their identity. I worked with a woman once who said to me, she introduced herself, and I noticed that she did this with everybody, and she introduced herself as someone who had a personality disorder, and at a very young age had taken part in a Channel 4 documentary called Blackpool's Youngest Boozers, Britain's Youngest Boozers, something like that. It really interested me that she felt that was her introductory statement as to who she was. Actually, she was a very different person from those two kind of identities. She was a mother. She was somebody who was really an interesting person and was doing various different things in her life, and yet those were the two identities that stuck with. I think oftentimes women take on the identities that they've been given over the years, and I think that's a really difficult thing to live with. I think trauma work that works is about almost a retelling of your story, so a bit of a rewind and going back and looking at where you've been and what constitutes your specific trauma, what is that? And I think oftentimes where people come unstuck is trying to describe to professionals, to social workers, to mental health workers, wherever it is, actually, who am I? finding a voice, I think, is really key to working with trauma, and, empowering people to be able to speak about, actually, who am I? What is my trauma and how does it present itself? And then being able to focus on that and give them the skills and awareness to be able to manage that. Because just in terms of something like personality disorder, a lot of women have said to me, I've got a personality disorder, I think I've got one, my GP said I might have one, or they've heard it along the line. And I've said to them, largely the diagnosis is just a part of it, but actually what you need to do is be able to learn how to live with that, to get the skills to be able to live with that in the world. And I think you could say the same about trauma, really, is what is your trauma? How does it impact on you? What are your thoughts, your triggers, your behaviours? And actually really positive work around that is giving somebody the understanding and awareness so that they can actually be in the world and ask for what they need, say who they are, instead of just continually presenting with this kind of firestorm of trauma, which then kind of feeds into professional perception of risk. Work that I've done with women is around to be able to start building a language of words and experiences, to be able to kind of put your thoughts across in a coherent way so that people can kind of hear and understand you. I think, when people have a significant level of trauma, I think they struggle to articulate what it is they're feeling, and they don't feel safe, and they have a foot firmly in the past, and they're looking at life through a lens of trauma, which kind of impacts on everything from just a difficult conversation to conflict, relationships, parenting, all of that stuff. It's working with trauma is about removing that lens. So that actually you're not looking through the past, you're engaging with the present and feeling safe enough in that present to be able to engage with it and change your behaviour, your thoughts, how you live in the world.
Yeah, and so how does that work? So you work with that individual. Do you work with social services and other people in their network as well? Like, how does that work, or is it more of a one-to-one sort of thing?
I think with Talk Trauma, we would work with anyone we would want to. We've heard a lot about services across the board really wanting to be trauma informed. Lots of people said we're really trauma informed, and that's absolutely brilliant. It's great to know about trauma, and I think everybody knows about trauma now if they're working sort of front line. However, I think the response to trauma is very different, and I think that's what counts. That's key, really. In terms of services, I think usefully, I think we need to develop a different dialogue around how we talk to people and engage them around their own trauma. I think everybody has got their assessments and their checklists, the things they need to kind of get through. However, you're kind of stumbling on that if you're not engaging that person in the present moment and understanding for them what that feels like, what their trauma is. So I think before you even have a conversation about can you parent, what are your routines and boundaries, what services are you engaging with, the first thing that I think frontline workers have to do is engage that person with their trauma. They have to engage with that trauma first. It's almost like if somebody has issues around drugs or alcohol, you're not going to have a coherent conversation with that person while they're under the influence of drugs or alcohol. And it's almost the same with trauma. You kind of need to engage with that trauma. You need to understand what that means and how that person responds, really. And it's not an across-the-board thing. I think it's about a creative response, and it's about developing a different language and taking time, I think, which we understand at Talk Trauma that social workers, for instance, don't necessarily have the time for that, nor do mental health workers who are trying to do a fairly quick mental health assessment. I've worked with women who couldn't sit through a mental health assessment, therefore don't get the service they need. I've worked with women who've been on the end of parenting assessments and can't sit in a room to do that. I think we need to do that work first before those things happen, and it's really difficult, and I do understand it's a kind of we can't be waiting forever for all these things to come together, but I think if services have better resources, and I do think there need to be better resources around how we respond to trauma. And how we assess people through that and work with them differently.
Yeah, so more of a preventative and therapeutic response rather than just dealing with the crisis.
Yeah, absolutely. I think someone who's experiencing trauma may feel like they're permanently in crisis. To be able to have a coherent conversation, you're going to have to work somehow with that so that you reduce their anxiety, reduce some of that kind of feeling of being overwhelmed. And I think people who are experiencing trauma often do feel completely overwhelmed and feel that they have no control over what's happening to them, and it's an impossible task. And parenting is a particular area, really. I think, having worked with women who have had children permanently removed from their care, and having an opportunity, space and time to be able to do some therapeutic work with using lots of different resources, absolutely with a creative focus, to allow those women to be able to talk and explore and gain some new awareness. I think what that really highlighted towards the end of that working process was that women could begin to see actually how their trauma impacted on their own parenting, how their childhoods had an impact on their own ability or not to be able to be safe parents to their children. And actually that was hugely reflective and heartbreaking, because having got to know those women and spoken with those women, their final understanding of actually what it all was and putting the pieces together only happened once children had been removed and they'd had that time and space to think about it, really, and to really do some therapeutic work. And then I think of women who are caught in that process, who are trying to do it while still experiencing a high level of trauma. It's really difficult.
I'm trying to think of the key things that I've taken that I'd maybe apply to my own practice as a social worker if I was dealing with someone, supporting someone. And I think it's just some of the language, being careful that I'm not adding to their experience of trauma, and thinking about some of the strengths that they have and capitalising on that. And then also just being careful of not re-traumatising, like you're saying, and going back through it, and also being respectful as well. If people don't want to talk about certain things, is it really necessary if I'm not the best place? That's sometimes something I think about. Because like you say, it's not the sort of thing that can be rushed, so it's just thinking of that as well. I think there is differences working in adults and children's services, but in adults, the people that I've been supporting have been experiencing domestic abuse themselves, but they've wanted to stay with the person, and part of my role has just been informing them of some of the ways that they can actually manage that risk and feel more empowered to feel safe whilst they're remaining in that environment. And I think that can be difficult, especially, you feel as a practitioner you sometimes want to protect the person and get them out of the situation, but it's not always possible. So I think giving people space is important, and making sure that people are informed and that someone cares about them is important. What do you think?
Yeah, I do think it's important, and I think it's empowering for people to understand that actually they're masters of their own destiny. And we are our own experts. The people that we're working with to support are fully aware of their lives in many senses, and the things that are difficult. And actually a lot of the behaviours that we see are around just being able to survive. And I think the thing around domestic abuse is a really interesting question, in that you can still change the dynamic of a relationship by some really good therapeutic intervention. And I think making decisions for people is never going to be helpful, is it? Because then they don't feel an ownership and they don't feel listened to and heard. And I think it's really important around domestic abuse that actually professionals do understand that adults can make decisions as to whether or not they want to be in a relationship and what that means. I think what you want to do is increase somebody's awareness and their perception and give them some knowledge and understanding and some insight. And in an ideal world, what we would recognise is that domestic abuse has at its root trauma, and domestic abuse is a symptom of trauma. Somewhere on that person's timeline, there has been trauma. That the need to behave abusively is born out of survival, really. This is the way that I have learned to keep people in a relationship with me, to keep people with me, beside me. Domestic abuse is just a symptom of trauma that someone's experienced. And I think we need to acknowledge that actually that's where the work needs to happen. And it's really difficult, isn't it? That I think in a lot of respects, what we do when we look at working around domestic abuse is that we give stark choices. And I understand that. So either you stay in a relationship and you understand actually that there will be consequences to that if you're a parent, because it's not about, this environment is not safe. I think for a long time the onus has been on women to manage those decisions, to manage their feelings, to make those difficult choices. There is a new thought and approach towards domestic abuse, and couples who are, where that's an element in their relationship, where they're parents. And I think the approach that's going to always work and provide a long-term solution and long-term sustainability by working therapeutically around domestic abuse and recognising it as presenting symptom of trauma. And once you've identified that trauma and you focus on that, you give some thought and encourage some engagement and reflection around that. I think that's when you start to give people the opportunity to behave differently and parent safely. It's a long process.
Well, you've given me a lot to think about. I think we've covered a lot there. What do you think? Is there anything else that you wanted to say, or do you feel that's okay?
I think what I'd say, 'cause I've heard a lot around trauma and I've read a lot around trauma, and I think there's a lot out there. I think as services we have to have courage to engage the people that we're working with differently and have faith in different ways of working and start to really explore those and build a different dialogue. That's absolutely what Talk Trauma is about, that sort of two-pronged approach to providing some different insight and a different way of working with adults who've experienced trauma, but also providing some workshops and creativity to people who themselves are people who are living with complex trauma. I think let's not keep saying we're trauma informed, but let's start responding differently and building those tool sets and resources into our day-to-day working practice, so that when we are presented with complex trauma, however that presents to us, and we know all of that terminology which really underpins adults with complex trauma, the non-engagement, the chaotic, challenging, difficult aspects to their behaviour, and let's start ourselves actively engaging very differently with their trauma so that we can get better outcomes and more sustainable futures for that.
Absolutely. Thank you.